Cancer is a generic term for a large group of diseases characterized by the growth of abnormal cells beyond their usual boundaries that can invade and spread to other organs. Cancer can affect almost any part of the body. In Kenya, cancer ranks third as a cause of death. Cancer being the third leading cause of death in Kenya, we are here to talk to Dr. Wairimu Waweru, who is a pathologist and a lecturer at the University of Nairobi.
Cancer is a disease that is feared by everybody, but it's actually an uncontrolled growth of the body cells in, say, an organ or tissue, and it grows until it destroys the surrounding and eventually even kills the person. There are many reasons why somebody can end up with cancer. There are some which are inherited, like you get children who are born with some genes which make them get given cancers. Then there are those who, the environment, like if you're exposed to the sun, some get skin cancer. Then there's what we ingest, chemicals, foods, drugs. Some are known to cause some cells to become uncontrolled, so they start growing and forming the cancer. When we get a patient coming with cancer, we look at the primary site, how large, how extensive, which organs are affected. Then we look at whether it has spread to the surrounding lymph nodes, like the ones we have around here. And then we see if it has gone to other sites. And from that, now we are able to categorize. If it is contained in the primary site, that is a stage 1. If it is involving some layers of the primary site, it's like a stage 2. If it's like the breast, it's, say, slightly bigger than the stage 1. Then when you start talking of stage 3, it's beginning to spread to the lymph glands around the site. It has gone through the blood into the lymphatics and now gone into the lymph nodes. That becomes like a stage 3. When it moves from there and goes, now you had the breast, now it is in the lung, and it's the same tumor that is now a stage 4. Or it has moved from lung to the brain or to the marrow, the bone marrow. Then that's what we call a stage 4. So contained, a large case which is involving other layers of the site, or the nodes around, or has spread to other organs.
When someone close to us, be it a friend, a family member, or a colleague is diagnosed with cancer, we all suffer. So today, I'm here with Dominic, who will be talking more about how cancer affects the family.
Well, my mom, when she got cancer, she was the one person I never thought would get that disease because of how friendly she is and how she gives back so much. But when it happened, I was like, okay, it's happened, and how do we deal or move forward as a family? It was last year. That's when we first found out she had cancer. We had gone for lunch, and she broke the news to us. It was shocking because I was just about to sit for my end of year exams. I had no idea. The reason she hadn't told us was because she didn't want it to affect our concentration. Everybody in the house was sitting for exams. She had breast cancer stage 2. First of all, the thing that affected me the most is the fact that she had to lose her whole breast. So she doesn't have a breast and she doesn't have lymph nodes. So basically, lymph nodes suck out, like subs from your arm. So my mom's arm sometimes is always so swollen, a bit swollen, and she always has to get like therapy and everything. So you find that it was hard having to get used to the fact that she doesn't have a boob, and seeing her going through the stresses of chemotherapy, which, by the way, is one of the most painful things I've ever seen her go through. The first thing that changed was first of all, you have to get educated on cancer, because that was my mom. I had to know this and that. Second thing is, when all this was happening, it was a time, for example, when the YouTube channel was growing, East Meets West, and I didn't want to use that as an excuse to miss shoots, to do this and that, because that for me was a passion, and my mom, I love her so much. So it was very hard to balance. So sometimes I'd come for shoots late because in the morning I'd have to take her to hospital. She used to go to hospital in the morning and in the evening. So that's a way it kind of really affected, not affected, but I had to adjust my life. And then, taking her to see the doctor, taking her for chemotherapy, seeing her go through the effects was the most painful thing. Because I remember once her nails used to fall off in the house sometimes. Siku moja anakucha, next day anakucha. Alafu unapata, like, there's once she had a very nice, because it makes you black. You tend to become black. So her skin opened up here and she had a very deep wound here. So the effects can be very, very heavy on someone. And she lost all her hair, she lost her weight. I remember even when she got the chemo pot, for example, she started walking with a kind of slump because of the pot. And those effects were hard for me to watch, because at the end of the day, that's my mom, that's someone, that's very, very dear to me. But the effects, I can say, also made me really strong, because now it showed me that, life happens, and you have to, come together as a family and move on.
We tell somebody, if you see a growth which was never there before, so like the women, when we tell them, examine your breast, if you feel a lump, then it could be cancer. Not always, but it could be cancer. Or if you are suddenly losing weight and you are not sick, you are not coughing, you are not having these infective conditions, then you have to worry that it could be cancer.
We are here at Rongai to hear the story on 26-year-old Jacinta Njeri, who is a breast cancer survivor.
It started on the time when I was 15, the time I was going breast. You see, like, you can have a hard stuff when you feel it. I thought it was just a fibroadenoma at first. And then when I was 20, I felt something strange. That's the time I went home and told my mom, no, I'm not feeling okay. You just take me to the hospital and then you see what's that. If it's a fibroadenoma, it's okay. If it is a lump, that's not good. Yeah, it was on that time is the time we went to Mukum Hospital. Yeah, and then the doctors found it. They say, this is not a fibroadenoma, it's a lump. And that is not good. Yes. Yeah, that is the time that they did the surgery.
What did they diagnose you with? What did the doctors tell you?
They didn't even go deeper about it, because they felt it with their hand. And then they told me, this is not good. That's the time that I did my first surgery. Yes. And then I thought, it's okay. This thing is not going to come back again. Yeah. And then in 2016, I felt something again. I was still in school. I waited to finish my first semester and then go back home. I told my mom, no, something is not right. Let us go to another doctor. Yeah, that's the time I went to Eldoret Hospital. And then the doctor had found it, because the tumor grew. Yeah, it wasn't that big enough. Yeah, it was still the benign one. Yeah, and then I had my second operation. They took the sample, took it to Lancet. They did further test, and then they told me it's a phyllodes tumor, which is the malignant one. Yeah, and then they told me, like, let us hope so, it won't recur back again, because some of it, the benign, they don't recur, but the malignant one, they recur. So they told me, like, I should go back after 3 months for further checkup. When I went back, they found that it has already recurred back again. No, my parents were not good. Yeah, because they were telling me, like, they don't know what this thing came. So they told me, no, let us go to a different doctor, the ones who will remove it and it will come back again.
Quite often, a number of Kenyans rush to seek medical help outside the country when diagnosed with cancer. But what do we know about cancer centers and hospitals in our country? Texas Cancer Center aims to provide individuals with quality care by availing personalized services.
Since inception, we've treated over 18,000 new cancer cases, but every day repeat cases are about 150 to 200, Monday to Friday. Out of the 18,000 new cancer cases, we noted that 60% are women and 40% are men. Yeah. The common cancers we see in women, number one is breast, followed by cervical cancer. In men, we see esophagus and prostate. And in children, we see a lot of leukemias and brain tumors.
Texas Cancer Center has one radiology machine. Radiotherapy is the controlled use of radiation to treat cancer either for cure or to reduce pain and other symptoms caused by cancer. Dr. Mureithi is a radiologist who delivers safe, effective radiation therapy to cancer patients with as few side effects as possible.
So I'm able to target the tumor for my
Education plays a significant role in the creation of awareness and the reduction of cancer deaths in Kenya. It was established in 1995 after recognizing that cancer was emerging as the leading cause of death in the country.
Kenya Cancer Association, with the vision of having a Kenya without cancer, does several functions. Number one, that is key to us, is cancer education and awareness, because we believe in prevention. Instead of us waiting to get the cancers, we are working in reducing the cancers by enlightening the public about cancer and also changing their behaviors in terms of adoption of healthier lifestyles and also of screening. So we do cancer education both at public community level, and also we have a program that we run where we target the corporates specifically, because those who go to work rarely have time to go and seek health information. So we take in the information to them. So we call it a Run at Work program, where we go to the workplaces and inform them about the cancer risk factors, and how they can adopt healthy behaviors. The second program that we run is patient support, which is dear to us, because we cannot be in this fight without the numbers that have been affected, and there are so many people who have been affected. And cancer, since it's a very expensive disease, it affects people of, especially the low and the middle socioeconomic backgrounds are really affected. So one of the major programs that we run, we support the Kenyatta National Hospital. We call it the feeding program, where those patients who undergo chemotherapy at Kenyatta National Hospital, we give them meals during the days that they're undergoing chemotherapy, since they're considered outpatient, so they're not given any meal. And Kenyatta is a national hospital. It caters for people from all corners of the country, from Mombasa, Busia, Turkana. So you can imagine a person from Mombasa sitting through chemotherapy without even a meal. So actually the program is to alleviate that short-term hunger and give them the boost to go through chemo with something in their stomach. Another program that we run is NHIF cards. As you can see here, I have a card. This is one of our beneficiary. So the program is also important because we know the cost of medication is very expensive, and at least we thank NHIF for the little that they've done, even though we still need the government to do more. So NHIF covers some cost of treatment. So we give those patients who cannot really afford that NHIF and NHIF card, because for some people, like a woman in Kibera will choose to buy the Sukuma Wiki for 20 shillings and not pay the monthly contribution for NHIF. So that program helps them get through the treatment. The third program in terms of patient support is also now those who've undergone now the treatment. We have those effects that you have to live with after the treatment. For example, women who've been cut their breasts from mastectomy, they don't have breasts. They may not have one or two breasts. And in the society, we live in a society where a woman is recognized by the breast. That's how the first look. So in order to reduce the stigma, we give them what we call prosthesis. And here you can see a sample of the prosthesis. So it's basically giving back a woman the breast. So, and giving them that confidence to walk again in the society as a whole woman. The other program that we do also in terms of support is also we give wigs. which is very important. We know one of the effects of chemotherapy is the loss of hair. And any woman, when you ask them what's your first identity, it's usually the hair. So this program is to give the women the boost and the confidence. As you can see, this is a sample of the wigs that we do the wig donation to women. This we do to any women who've had chemotherapy and have lost hair. Another one in terms of support is we also support a special group we call the colorectal, the ones who handle the colorectal cancers. They're called the Stoma World. So those who've undergone colorectal cancer, they may have colonal rectum cut. So they need an alternative route to go through the toilet. We call it the stoma, where you have a hole inserted inside your colon. We take going to the toilet. Going to the toilet for them is actually a privilege. So they use special bags. We call the stoma bags, and this is a sample of a stoma bag. So we help support the association get some of the stoma bags. We may not necessarily meet the needs of all colorectal survivors, but we help them to at least get the bags to a few people. The bag ranges from the cost of from 1,000 shillings to 2,000 shillings. So you can imagine when you have that person who really cannot even afford to buy food, they rather buy a stomach bag or eat the meals that they have. So you find people in the society who actually stop eating because they fear now there's no way they can control the stool. So they die, and people die in shame. So that is the importance of those bags and that support group. Another support group that we help we've started helping recently is those who've lost their voice boxes. Talking is actually a privilege because there are people who've had their voice box cut and they need a special aid to help them speak the way I'm doing. So the voice box costs from around 90,000, so from 70 onwards, depending on what the kind of processes to be given. So at least last year we gave a donation of 2 processes, and we are working to increase our donation as the year goes on. That is in terms of patient support. And of course we have other supports like the lymphedema sleeves for those who have swollen arms. And now the third area where we work in is in terms of research and advocacy, because there's little that we know about cancer, and especially within our environment. Most of the things that we use are from the other countries. And in order for us to advocate and even to push policy forward, we need figures, we need data. So we actually focus on doing research that will enable us to push the cancer agenda forward in terms of policy implementation or even affecting policy one way or the other. So those are the key areas that Kenya Cancer Association works in. We can see that the number of deaths in the country some of it is high because people cannot afford the treatment. People in the communities will tell you, I don't want to go and get tested because I will not afford the treatment in one way or the other. So if we want to change the narrative of cancer killing most Kenyans, then also cost of treatment affects access in treatment. So this is an issue that the government of Kenya really needs to look into.
When it comes to diseases like cancer, it's all about the money. The money will determine the kind of service or healthcare you get. If you have a lot of money, you have access to the top quality doctors. If you're not as fortunate, unfortunately, you don't have access to the top of the top.
The first operation wasn't expensive because that lump was just small. Yeah, I can't remember the price clearly. I think it was 30K there. It wasn't expensive. And then the second one, it came a bit expensive. It was like, I think it was 70,000. It was just the operation. And then I went to Kenyatta. At that time, I knew it will be expensive. Yeah, because the tumor has grown. That is a mastectomy, and then another operation because they call another plastic surgery who did the philanthropic reconstruction. I knew it was going to be expensive, but at that time I didn't have the NHIF card. Yeah, but my parents didn't even have worry about the money because they wanted me to be okay.
Our lifestyles have changed. We are eating foods which make us have constipation, so people are getting cancers of the colon. If you're eating things which have toxins that can bring cancer of the colon, then you end up with constipation because you have changed your diet.
Very important for the whole country, for every one of us, to change their behaviors. About 30 to 50% of cancers are preventable by healthy behaviors. So by enlightening the public and giving them the right information, then we are also contributing towards a behavior change, which is very essential because we can see there are some cancers that we can really reduce.
People get cancer for different reasons. It varies. There are very many reasons for someone to get cancer. And these things that people talk about as serious. Your lifestyle can make you get cancer. If you're a smoker, you can get it. If, you know, for example, you eat too much red meat, you can get it. These things can cause you to get cancer. And it's for us to also learn, be educated about these causes. Yeah? So when it happened, our lifestyle changed. My mom stopped, you know, fried foods. We only used to do boiled foods.
We have very good facilities in the country. We have some of these major hospitals like Kenyatta National Hospital, the private hospitals like Nairobi, Aga Khan, MP Shah, whom we know give quality services. And we are even now privileged to have a PET scan that is now operating within the country, so we can see the cancer treatment is improving. Or even now having better diagnostic services like the liquid biopsies being undertaken. So the quality of the treatment is actually increasing in the country. So you can say the quality is good.
There was an option of going to India, but because luckily, for us the biggest advantage was that my parents were able to afford the healthcare, and it was very expensive. I think her drugs were, I think if I'm not wrong, it was maybe I think 4,000 bob a day, 4,000 or 5 Gs a day, and those were just like blood thinners. Blood thinners are drugs where you get when you go for chemo. You know, it affects your immune system, so your blood is weak, so you can't clot. So she needed something to help her clot. So she couldn't do stuff. She had to get stuff like a chemo port and stuff like that to get the chemotherapy. But the one thing that we found out was that drugs for cancer in this country are so expensive, and they have different quality levels depending on the hospital you go to.
Cancer care is expensive and complex because cancer is not one disease. And then the other problem is that people are not aware of the serious nature of cancer because many come late, having been misdiagnosed and treated for other ailments. And when it's finally confirmed that it's cancer, it's already in the late stage.
In terms of the cost, this is a major hurdle. The cost of treatment in the country is still very expensive. You can see from where accessing the public hospital, chemotherapy cost can range from 15,000 to even more. People can even get treatment even to access of 1 million shillings, which is very expensive. We know patients like those who have HER2 type of breast cancer, they really have the hurdle because one session of Herceptin at a public facility is 160,000 shillings, and they have to go through 18 sessions. So the cost is very high for any normal Kenyans. So in terms of this, we are even looking into asking the government to even think of options like zero rating chemotherapy drugs, even to reduce the cost of treatment burden.
The reason why people go to India is because it's cheaper than back home, which is very, very sad.
There's the myth that when you go out, that's when you get cured. What you don't hear are the ones who went there and nothing, they were not cured, they came back in coffins, or they came back and continued treatment here. You only hear the success story. You don't hear the ones who didn't succeed.
I'd love to see the government do more on this whole cancer thing, because like for us, the money was there. What if there was no money? What would have been the case? Would I have had to drop out of school for my mom to get healthcare? Would I have gone through mental depression because I never talked about it to anybody? The only people who know are close people to me, like Bobby and Nibubu. I used to come to school, smile, and not talk about what my mom was going through, because that was a battle for me to face. And
some of these programs directly even help patients one way or the other reduce that stigma and discrimination in the society. So it's helping in the survivorship of the patients.
At first it was hard because, like, for example, like you want to date and then you tell someone like I'm like this, they'll really see like it's strange. No, I can't date you, you see. But for me, I've never experienced that kind of thing. Yeah, it wasn't hard for me. Yeah, if you refuse me because I have one breast, it's okay. You can just go. Yeah, because like I can't avoid it. It's permanent and it's going to be permanent. Yeah.
Some of these patients that we do directly with the patient, they directly impact those individuals. So they change their lives in a meaningful way. People stop seeing cancer as that disease that robs you of everything, and at least you have that leap of hope that beyond my treatment, there's something that I can live for, and it helps you also move forward.
After cancer treatment, we actually keep in touch with our patients. We are like a family, and we share a lot. They have formed a cancer survivor group called Uwezo Cancer Support Group, and they actually come once a month. They meet, ask questions, share experience. They come to hospital, volunteer. They pray for the other patients, give them encouragement. They go out, even we support them, go to the communities and talk about cancer. So there's a lot that is going on, and even this year we had a beauty pageant deemed Life After Cancer, and they participated just to express the beauty inside them, that even if you have cancer, that's not the end of life, that you're still a beautiful person, both inside and outside, and people still appreciate you.
It's painful to see someone you love go through it. You know what I'm saying? Financially, it takes the money. Emotionally, there's a pain. You know, physically, there's a time. You know? So it can drain a family, but let me say this again very clearly, it can also build a family. Yeah? It can also build a family. A family can become more stronger than ever because of going through such an experience together.
There are some who come ready to fight the cancer. So you see now when they come that their immunity is up, so even when you knock down their tissues, because cancer knocks down even normal tissue, but the normal tissue recovers. But the cancer one now gets knocked down completely. So you want somebody in a good, hopeful mood that you are able to do something. So it varies. Some may come knowing they are dying, but they survive for some years. And then the others who will come as if they are okay, but then when you give them treatment, it knocks them down.
I just knew like this disease will come out to anybody here. I don't know how it came to me, but I accepted it. I know like at that time, it was hard for me. Like I was still thinking, how am I going to live with one breast? That is not okay for me. Yeah, but I came to it like, I know like a lot of people were seeing that scar, they were telling me, it looks weird, it's scary. Yeah, I was hiding it, I didn't want to show it to anybody. Yeah, that made me feel sad. But I came to realize that this is something that came to me as a disease. I can't hide it. Let me even show it to people. I just tell them that it won't kill your dream because of this scar. It won't even end your life. There's a purpose that I'm still living. There's a purpose that I'm alive. The disease is over. And this scar, I can't hide it because I know there's some people who are sick, the same condition, but they're hiding it, and it's not right about it because it will kill your courage and even your strength. And even right now, I used to say, like, I'm not ashamed of my scar. Yeah, it showed that I'm alive. It showed that I have that courage and strength, and even it will encourage someone that he or she is going to be okay.